For a while now, Nigeria has been reporting low daily toll of new COVID-19 cases, while many parts of the world are dealing with a more ferocious outbreak. Some countries have even reintroduced lockdowns in a bid to curb further spread of the COVID-19 pandemic. At this point, it is crucial for Nigeria to step up efforts to ensure that it does not find itself in an overwhelming situation like India, which is battling to get a grip of the raging pandemic. Joining me via Skype is Dr. Alero Roberts, a second Vice Chairman, Association of Public Health Physicians, Lagos Chapter. Good morning, Dr. Roberts. Thank you for joining us on TVC Breakfast.
Thank you very much for having me, and good morning.
Good morning once again. Right, before we get into preventing a third wave in Nigeria, let's perhaps take a look at how far we have come. When you look at the number of testing we have done so far is just a little above 1.8 million out of 200 million Nigerians. And you also look at the fact that we are still trying to ensure that a lot of persons get inoculated. Are we really on course when it comes to ensuring that we do not get into a third wave? Because if you also look at the aspect of compliance with the safety protocols, it seems life has returned to normal and there is seemingly no enforcement as we speak.
Well, that's a little difficult to say, because even though the testing is, like you said, 1.8 million out of 200 million is still less than 1% of Nigerians, the truth of the matter is we still have very low positivity rates, and that's an indication of how the disease is in the community. So, you know, we've got like a sample of the population being tested, and in that sample of the population, the positivity rate is still rather low. However, that's not to say we've gotten rid of the virus. So please, we should not be in any way deceived or fooled or complacent about the numbers that we are seeing. Question, are we on course to saying that we've defeated the virus? I think looking at what is going on in both India and Brazil, we do need to be very, very cautious about what we're doing. And you can imagine that for a lot of us in the public health space, we have been watching those countries with a great deal of concern and trepidation. In fact, I would say fear and trepidation, because there's absolutely no difference geographically between those countries and ours as to why they should go in one direction and we seem to be going in another. It is important to note that the perfect storm that seems to have led to the increase of cases in India and what they're seeing today could easily have taken place in Nigeria, but for two things. We have had commitment from the top to public health interventions of spacing, social distancing, hand washing, wearing masks, and avoiding large gatherings, and that has been vitally, vitally important. And we've also had a lot of commitment to making sure that we can prevent transmission by these means. These were things that were not taken so seriously, particularly in a country like India, where, I mean, where we are today is where India was towards October, November last year, when their cases were literally down to nothing compared to their population. And suddenly we're seeing what we're seeing. So we need to be very, very, very committed to the public health interventions. That is all we have. I worry, because India was the medical tourist capital of the world. So if their health system can be in such disarray by this virus, then you can imagine what it will do to us if we become complacent.
Now, speaking about India, what the government has put in place is a travel advisory that Nigerians shouldn't perhaps travel to India and Brazil, like you mentioned. Is that in itself enough? I
mean, that isn't even rocket science. I don't think the government has to even issue a directive not to go. Who in their right mind would get on a plane and fly into India or Brazil? If you even had a cut on your finger or needed any kind of medical intervention, where would you go? So that is very important. And I mean, considering that we do need the trade that comes out of India, we have to also, the government also has to be very cautious about some of the pronouncements that it makes. So yes, certainly limiting travel between Nigeria and those countries is important, because we certainly don't have the infrastructure to cope should another wave of the virus erupt in Nigeria. It's it's sufficient for now. The more important thing is that the government should maintain its stance on mass gatherings and making sure that people wear masks in public, ensuring that there's water supply and sanitation hygiene to make sure people can keep their surroundings clean, wash hands regularly. That is actually of more use to us right now because we don't have much else.
Now, the priority for the Presidential Task Force on COVID-19 is to scale up capacity to prevent a surge in cases, given the increases that we have pointed out in countries like India and Brazil. So if we had to scale up capacity, what areas do you think that we should channel our energies on?
Starting from the top, it will be revitalization of the primary healthcare system, because that is the most effective way we will have of maintaining active and passive surveillance of this disease. The testing is complicated and difficult. We are hopeful that the rapid tests will be widely deployed. I know that they are coming in fits and starts, but we're hoping that it will be rapidly deployed, particularly for areas where there is perforced mass gatherings, transport areas, bus stations, railway stations that are opening up, and so on and so forth. But certainly, revitalizing and revamping, strengthening and empowering the primary healthcare system, for me, is absolutely paramount. Making sure that there are health educators, health promoters who can go out and continue to engage communities to make them aware of their risk of contracting the disease, amongst other diseases, of course, and making sure that we have community health extension workers, we have community health officers in place. Physicians and nurses are, a rare resource now. So we have to make sure that we have the primary healthcare system strengthened and empowered to deliver on active and passive surveillance.
Now, speaking about the primary health care, some persons are saying that perhaps the way we have ensured that the primary health care is also part of those who are, giving the vaccines to Nigerians, that perhaps we can deploy the aspect of testing to the level of primary health care so that we can ensure that a lot of Nigerians are tested. What do you make of that?
Well, now, sample collection is deployed to the primary healthcare sector. So there are two aspects to the testing. You collect the samples, but they need to be tested in level 3, level 4 biosecure labs. So those are, I think we're pretty much at 67 biosecure labs around the country now. So the collected samples then are transported to these biosecure labs where the actual testing takes place. But sample collection has been deployed to primary healthcare system as at now, and certainly it's working in Lagos State.
Now, there are still concerns about vaccine hesitancy. We are still administering vaccines. I wonder how you think that we can address that situation.
It has to be with continued community engagement. It has to be with people who have been vaccinated, such as myself, going out and saying, this was my experience. Yes, it was a painful shot in the arm. Yes, I had a few aches and pains the following day, but by and large, I feel a lot more confident now that I am safe from severe disease, and I'm certainly safe from being hospitalized and intubated. I am waiting eagerly for the second dose, and I do pray and encourage the government to please make sure more doses of the vaccine are made available. I mean, we got 3.94 million doses in a country of 200 million, hardly a drop in the ocean, but at least it's a start. And the frontline workers and the vulnerable older population were targeted. But we do need to get a whole lot more vaccines into the country. If possible, set up our vaccine production laboratories, vaccine production system here as well. We're well able to, and we can, the financing can be made available if we commit to doing the right thing and commit to doing what is needed for the country.
And that is what the focus of the vaccination week has been, investment, such that we can have vaccination that will bring the world together. But we haven't seen that level of commitment that you mentioned.
Well, we will not see it till the vaccines are actually available to be deployed. A lot of these things do take place, as it were, underground. So you won't see people coming out and say, yes, I pledge 1 million, I pledge 2 million. No, the funding is put together. The vaccine production factories, so to speak, are put together in secure places. So that doesn't actually come to the public eye. And what the public then sees is the end product, which is vaccines are available. So a lot of work is taking place. I know that, but it's not actually public news yet until the vaccines are available.
Now, so because a lot of people think that if this information is made public, perhaps that could encourage a lot of Nigerians to believe in the system.
No, I don't agree with that. Vaccine hesitancy still is a personal thing, and it is still based on what the person knows or doesn't know, believes or doesn't believe. So I know a study did take place. I mean, I was reading the paper, funnily enough, only yesterday, where 1 in 2 people expressed vaccine hesitancy for a variety of reasons, all of which was based on the information they had received, the source of that information, their level of education, and their social class, so to speak. So it is something that we still have to address, and at the end of the day, it really is by one-on-one community engagement where you can sit down with a small group of people, listen to all their concerns, address all their questions, bring to their knowledge the actual scientific facts available. But it's not easily done as a blanket statement on television. It's far more easily done when you engage at far smaller levels, at far lower levels. So that is the importance of having continuous community engagement, relying on the religious bodies, community development committees, development organizations, NGOs, to actually deliver information that is relevant to the community that you are delivering that information to, is what we call risk communication in community engagement.
Right. We'll leave the conversation there now. Dr. Alero Roberts, Second Vice Chairman, Association of Public Health Physicians, Lagos Chapter. Thank you for your time on The Breakfast Show.
Thank you very much for having me.